Welcome everyone to our lunch and learn session for today. We want to welcome board members in attendance, faculty, CHWs, and AHEC scholars as well. Today's presenter will be Miss Kathy Nelson. Kathy Nelson is a master trainer, coach, and education developer for the Salt Lake County Caregiver Support Program. She provides skill-focused education and assists with a variety of support groups. Salt Lake County Aging and Adult Services caregiving publications are freely available in a variety of languages on saltlakecounty.gov/caregiver. I will make sure and put that on the chat. If you are an AHEC scholar, please complete the form on the chat that belongs to your cohort. So we have 2023 link and 2024 link. I need you to fill that out in order to claim your attendance for today. And we will flash that on the chat several times throughout our hour. It is a pleasure to introduce Kathy. She is a very active collaborator with University of Utah Research, giving her input and her expertise in many, many projects that we do. And let's welcome her warmly. Please make sure you post your questions on the chat or raise your hand. We want this to be very interactive. Kathy, the time is yours.
Thank you, and welcome everyone to this fun little lunch and learn discussion. You know, I was telling the others that every time I'm about to train on a particular subject, for whatever reason, I kind of go through that with everybody else. So I'm really excited to share today's subject because it's very near and dear to my heart. And it's one I've been working on for years as an advocate to try and get more connection between the hospitals, hospital staff, just medical care in general with the caregiver instead of just the person who may be going through the care. So I'm going to share my slides, and then this is going to be very interactive, and you can put your hand up, ask a question. You can just unmute your mic, anything that you need to do, and then you'll be able to, hopefully I can see, or one of the others can help moderate those questions and stuff too, just to point one out if I tend to miss you. So like I said, I have been in aging and adult services here in Salt Lake County government for about, well, just over 18 years. And I decided to spend the last part of my career in this education field with caregivers because of the connection I've had to it. I have had grandparents with cancer, Alzheimer's, dementias, other things that I have always cared for. But now that I am what I call the second generation, one down from the last generation, there's a lot more care and a lot more emotion in things. And so it's just a fascinating thing to think about how we can add value to healthcare, both in sharing, advocating, and supporting clients and their families. I mean, there's just so much that can be done from the health industry. And just the little value adds that you make are just powerful in every way. So I hope in what we share today and what you share, that it will touch your heart and help you find ways that you can improve things in your own offices and your own spaces. So the first thing I want to do is take you right into aging or even into caregiving. It doesn't have to be aging per se, but I would like to add, oh, I have a hand up. Go ahead.
So we are not seeing your slides. Are you sharing them?
Yes, I am.
I am seeing them, Prithvi. Yes.
Okay. Yeah, I see them. I'm sorry.
Okay, good. Yeah, just so you can all see them. That's perfect. Okay. So I want to take you into this realm because it has to be personal for us to maybe think about how we personally can make a difference. So I want you to close your eyes for a minute, or even if you just want to look down or whichever, and just say, I want you to visualize aging. What's it going to be like for you based on your current decisions and what you're doing with your life? What do you even visualize aging as? Are you going to be a global traveler? Are you going to be facing chronic illnesses? I just want you to visualize that in some of the concerns that may face your family that might be genetic or anything. And just kind of look at that. What do you expect to see, or what do you expect when you age? Are you expecting that you'll be able to get medical appointments? Are you expecting there'll be plenty of doctors? Are you expecting that there will be plenty of transportation units for you so you can always get where you need to on time? Do you have 3 children that will be supporting you? I mean, what do you really see here? And what do you feel? You know, are you nervous about aging? Do you feel like I've got this? I'm putting things in place that will help me. I know what my advanced directives are. I know all of those things. And then the all important question at the bottom, who is going to take care of you? Meaning, who's going to help you solve things with paperwork or hospital visits or your medication and all of that as you age up? And it's a really serious question. So I'm going to stop sharing for a minute and ask you to put a few things out in the chat channel of what you just envisioned when we were talking. Anyone able to chat out there yet? Okay, weakness and potential dependence. All right. Any other thoughts? Some of you may be listening in and unable to chat at this point. So I want you to really think about those. Okay, in spite of our best efforts to take care of my parents, we find that systems are hard to navigate. Perfect. That they are exposed to a lot of scams, right? Okay. Aging parents who need a lot of help. So this is on my mind a lot, okay? Yeah, and these are issues that you're dealing with your parents. Now, notice how we're associating it with someone else right now. That's very normal for our age group. We associate, if you're anywhere between 35 and 65, you're usually associating aging and concerns and healthcare with somebody else, an older sibling, maybe a sibling with a chronic illness, parents, grandparents. We're always tending to associate it with someone else. But we need to start thinking about it from our perspective. I mean, what's going to happen to each one of us? Because that's when you start thinking about healthcare and what you offer in your offices or what you offer as professionals from a very clear standpoint of the human nature that's behind everything. And that becomes really, really important. Okay, so we're going to go ahead and share this again. All right. If you can't see the slides, let me know, but I'm assuming that you can. All right. Now, the second set of questions I want you to think about is if you're needing help, I want you to take this right down to the basics. Imagine you can't drive or walk well. What kind of assistance is going to be needed there? If you envision your office, and we'll do a little bit of this later, imagine you cannot drive or walk well. What does that mean for how many parking spots there are for handicapped drivers? What does it mean for the types of sidewalks outside of your office? Or what does it mean for the grab bars, anything that's going along? What about the elevator ride? You have to start thinking about all of this because it's all part of the experience of going to a healthcare professional. And honestly, if all of these individual steps that happen first don't go well, that's why they show up in an office discontented, unhappy, stressed out, and it makes their visit with you even worse. So we have to start thinking about the whole process of getting someone there and what does it look like when they show up in your parking lot, all those things. So imagine also being ashamed. What if you're short on food or you can't read or you can't write and you're afraid to tell your healthcare professional and they've just handed you a stack of papers and they've said, go home and, make this work. Yeah, there's another comment out here too. I was also going to say it has helped me think of what aging will look like for me. So thank you. I envision decreased independence and needing assistance with driving appointments that you mentioned. Yeah, awesome. Okay, so But imagine, I mean, we go into homes sometimes and guess what? There might be just a few ketchup packets left in the refrigerator, things like that, where people have such limited incomes, they may be not knowing about aging supports and some of the other things that they can get. And so they will actually go out to lunch once a day with their minimal food, and they may go to a place that has a dollar menu or at least a lot cheaper value menu. And then they will get a few extra ketchup packets and salsa packets and things like that. Anything, little grape jelly packets or whatever they can find along there. And sometimes they will be eating those at home. So you just never know what one of your clients might be facing. So, even something simple like a water container in your waiting room where they can get a drink of water and stuff like that makes it essential to a really good hospital visit. Some offices can afford that, some can't, but think about those options. I've been in quite a few emergency rooms, unfortunately, lately, and even ICUs and other things, and how they were set up and what they can offer to take the stress off of me so that I can function with them is an essential part for a caregiver. So imagine you have limited or no family or friends. So imagine you're doing this all on your own. You have to start thinking about those processes. If someone's really on their own and they had limited education ability and maybe, they don't have a lot of neighbors that they are good friends with to where they can even ask for help, how do we help them actually get their medical care? And we'll talk some about that. Imagine being burned out or yelling at your parents. We have quite a few caregivers who just sink. They get really tired. I'll just tell you, 4 weeks ago, I was hiking with my sister in Sicily, and a week after we got home, she ended up being life flighted to ICU for a diabetic coma. So things can change so fast, and she's our primary caregiver. And then I have two parents with Parkinson's that she was the primary caregiver for. So now I have 3 care receivers, and I'm running around trying to get everything I need from various doctors' offices. And let me tell you, if you ever felt like you were in a rocky boat, if you're a caregiver with multiple care receivers, and you are going in and every doctor's office you enter has a different process, a different look and feel, different elevators, different walkways, different hallways, that can become overwhelming. Just the fear, not the fear of it, that's already there with your care receiver, but the shock of all these different types of places that you have to walk into and navigate, let alone the paperwork and everything else. So I really have some unique insight over visiting a whole lot of different kinds of offices in the last 3 weeks, ranging from dentist offices to nursing homes to hospitals to ICUs to all of that. So I've been in them all. So imagine being burned out because you are taking on a lot. And you feel so guilty if you're not being perfect as the caregiver. But it's really hard to be perfect when you don't understand all these different worlds that you're walking into, and every single one of them has their own language. How do you speak, doctor? How do you speak lawyer? How do you speak legalese so you can understand the paperwork? And then how do these thoughts make you feel when you start thinking about the complexity that you work in? In all honesty, you're working in a very complex world. And you have people that are really coming to you feeling like it's their last chance to get it right or their last hope to help their family members. So it gets pretty personal. So let me show you some of the needs that our caregivers have. And I want to introduce you to some of these circles that I've got on here. These are some of our actual caregivers in Salt Lake County. We did a project about a year ago called A Portrait of a Caregiver, and went out and captured stories from some of our caregivers and the actual worlds they live in and how it functions. And it was a real eye-opener, and it was also beautiful to be able to put those photos and stories on display here at the county building so that people could see them and, just have a little bit of insight into what's happening in a lot of the worlds that we work with. So I want to help you understand maybe some of the needs, and a lot of you, it sounds like, are actually dealing with this. So it won't be new to you, but I'm going to talk to you about some of the support systems as well. So you have in-home care and homemaking that really pop up first on the list. You start wondering, okay, mom doesn't have the strength to push the vacuum anymore, or wow, I've got to get a better shower capability for mom. Does it take a shower bench, or will it take a complete bathroom remodel? And it can stem anywhere along there through any of them. And so it can be any of those. So like we just went through a complete bathroom remodel for my parents' home, luckily, right before all this happened, which set us up perfectly to assist all three of them together in the same space for a while. So the in-home care became essential for this walk-in shower with a fold-down seat and all those things. So luckily we were thinking ahead, but you just never know. You may not be ready for it when it happens. And most caregivers are blindsided because, like in our situation, one day everything was great, and 3 days later we were in ICU for 10 days. So you can about imagine. Okay, it says, I have done a lot of geriatric home care physical therapy, and I often find that patients need a team of therapists in addition to family caregivers. A lot of people have stigmas associated with aging that stop them from asking for more care and or don't know the resources available. And that's absolutely true. Thank you for sharing that. Yeah, that's absolutely true. I have a father who thinks we can all do it on our own, and why do we need to bring anybody else into it? And I have a mother that says, yeah, that paperwork's great, but why don't you just help me with my showers? And, you know, we have to have those conversations of why. And usually we have to take it out of the hospital setting and apply it back to us as caregivers and say, because your caregiver's tired and I can't do it all, can you please bring in at least one or two people to help with some of it? So half the time I can be your task organizer, and half the time I can just flat out be your daughter still, because that's what's really, really important. So there's also transportation and mobility, and a lot of people don't realize that there's some programs that they could call 211 or look up 211utah.org and look up some options. One of them might be the Rides for Wellness here at Salt Lake County Aging, and the other AAAs or area agencies on aging around the state of Utah. There's some options for them to look at that are maybe discounted rates based on, you know, a donation, or they can get that for free if they really have no way to donate or anything. It's part of their government programming. So there's just some things that they're just unaware of that I really promote the 211 website and that ability to call 211, because they get more updated and trained better on the whole scope of things for social services across the states they represent. That's available in every state in the nation. So that's a really great thing for them to have this opportunity to look up different options. And as we know, no caregiver is in one generation. You're not just caring for your parents. You might be raising children, or you might be a grandfamily. You might have inherited the full-time care of your grandchildren, and that might be complicating issues. So you're needing everything from how to register someone in school to, you know, how to hire someone in to teach you how to care for someone with a feeding tube or some other complicated issue. So that is just all part of this world. So you can imagine when you send somebody home and you give them one instruction, they may have 20 other instructions they're working with from everyone else too. They may have 3 new meds that they have to figure out how to put in the box and where to pick them up, and if they have an information release form so they can actually get them for their parent, all those kind of things. And then right when they think they've got it all balanced, something else will happen, whether that child gets sick at school that they're caring for or whatever it is. And then, of course, they have the work care balance that's really difficult for them as well. Do you have enough sick and leave time? Do you have vacation? How do you apply for family medical leave? And that's not as easy as it sounds. Let me just tell you, this week, I've been running to 4 different doctor's offices, getting information releases because my sister was primary. We had to add a couple of the rest of us on to make sure we could balance all this. And you're filling out all of these, you know, paperworks for your office and your work, and you're trying to get it to the doctor's offices, and they all have different processes for how they'll fill it out. Some will fill it out for you and send it back. Others say you have to set up an appointment and come into my office and discuss it with me, and I'll fill it out with you. So as you're running around, the more stress you can take off people who come into your office, the more you can offer them as an ease of process. I mean, think about that when you're building your protocols, your procedures, and your processes, because some offices I've walked in have made things very, very difficult. Other offices are completely supportive and have gone the extra mile to assist. So it will just depend on what you can set up. But food and housing deficiencies are really high right now. I don't know if a lot of you heard, but this year when we got the data back, probably the data's from last year, but Utah was one of the #1 states in the nation where people were passing away from food deficiency. So now that was horrifying to me, considering how many food banks and the assistance that we have here. It's just people may not always know about it. They may be embarrassed, or they just may get too sick and tired and not reach out for it. So doctors' offices, dentist offices, everybody that's in the medical field has a unique way, because most people come there at some point, or at least a great many of us do, to say, hey, do you know your resources? And then, of course, there's legal and medical that's just really difficult. And what's the difference between Medicare and Medicaid and all these crazy things? And a lot of people don't know that they can call their area agency on aging and speak with a Medicare specialist that can tell them about stuff in their area and even may be able to meet with them one-on-one. It's a little more limited during open enrollment times because so many people want appointments, but you can meet with them all year long to make sure that you're headed in the right direction based on what your plan offers, things like that. There's also literacy and access. So we're going to talk about a few more of these. All right. So I want to talk about some of the bigger types of resources, because these are the ones that lead you everywhere else. And I know it's really hard, and you are welcome to request a copy of these slides from, or it'll probably be online. I'm not sure how you do yours, but you can look at these slides and go into these links anytime you want. But the area agencies on aging, these are the boots on the ground. These are the county units that put in place all of the aging and adult service programs for the state of Utah or across the nation. And this eldercare.gov is now eldercare.acl.gov. I'll put that in the chat channel here in a moment. But they've added that extra little set in there from the government address, but this will still take you there. That is where you can put in a zip code and you can find any area agency in the nation based on the zip code. All of the zip codes are owned by someone. And so, like, if you put in 84109 for down here at the county building or anywhere else, it will show you which area agency on aging in the state of Utah is assigned to assist you. And it will give you the website link, the phone numbers, everything to get you around the nation. Maybe you've got an uncle in Florida, an aunt in California. You'll be able to direct everybody to their area agency on aging. The caregiver support, this is our main website right here. We just changed our URL. So if you are familiar with Salt Lake County, but are wondering what's going on over here, we just changed our URLs. We are now saltlakecounty.gov. And then if you put /caregiver behind it or /aging, it will take you right to the information you need here. And there is so much out there. It's really hard to kind of talk about the types of things that we offer, but we do have low-income programs that people can apply for to get assistance in the home. There are waiting lists for some of these. That's natural when you have a lot of aging people currently in the system. You also have a caregiver support program that does not have a large waiting list. So if we have caregivers that are in need, they can go look at this website, see the eligibilities and say, oh, I could apply for a limited respite program where a case manager could teach me how to do all of this and help me get set up. I can go to free classes, and there's 5 different support groups I could go to. And there's all these types of services that exist. The hard part with government agencies is that we keep all of our funding for the actual services, and we don't have a lot of funding for marketing. So we rely on these kinds of presentations to let you know we exist so that you can tell your clients. I just lost you all.
Miss Kathy, we have a question. Can you hear me?
I think she said she lost us.
Oh,
Maybe she went to connect in something else.
oh.
But I still see her screen.
Close the door. Want now? Okay. So we talked a little bit about the saltlakecounty.gov caregiver site, but we have a lot more out there that you'll want to go explore. A lot of people don't even know that there is a caregiver support program associated with the aging world. But there's also the caregiver support program at the VA for veterans. There's also a lot of in-home services that can be applied for. So if you go out to our website or if you go to 211utah.org, that will help you just get to know the types of things that are out there. Okay. Senior centers. We have a lot of senior centers around the state. A lot of people don't know that we have just 16 right here in Salt Lake County. That's just the ones we run. There's 2 or 3 others that are run by their cities that are not part of ours. So that looks like 19 of them. And one of them is virtual. That way, if people are at home and they need social engagement and that will help them with their mental health, that's a perfect way to get them engaged as well. So another thing is the other social options that you want to be able to refer people to. I always send people to get started to nowplayingutah.com. Have any of you heard about this one?
No, I haven't heard about it.
Okay, nowplayingutah.com is a really great website where it shows all of the types of fairs, public stuff, free classes, painting at the zoo, anything you can imagine that's going on in Utah. It also has all of the sports stuff, the theater, anything you can imagine. And so you can go out there and find all kinds of things that people could go to free and do anything that they would like. And one of the things we find with our seniors and our caregivers is because they're not socially as engaged, because they have so many tasks to achieve, they tend to have a lower mental health wellness. And so getting them re-involved, even teaching them that it's fun to take a ride on Front Runner because it's not as expensive as people think. They could take hot cocoa and a sandwich and ride from here to Provo and back just for the fun of it, to go on a train ride. It's indoors, it's warm. There are restrooms right there in the train car with you. So just even silly, fun things like that, that you can help them to be socially engaged. Our senior centers, people tend to get confused. They think that they are not social hubs. They think they're more like a day services for seniors. I'll just go park mom and dad there and then pick them up after work. That's not what they are. Just to make that clear for people. They are a very vibrant place where you can go and take language classes, have a hot meal for lunch, socialize with others, volunteer your time. We have various groups that sew and crochet and donate blankets to the various hospitals and make newborn kits for various things. And they're just very active. Different centers have different programming. But they can also go there and just play games or cards or attend a support group because they really need, to chat about their own aging process. Or maybe some of them are caregivers to their older spouse, or they're needing help, or they've got a child that's got concerns and they just want to get together with other caregivers and talk. We have just a lot of programming there for you. So those are things that you can, yes.
I may ask you, I remember you mentioned at a different meeting that I was with you about services for the unsheltered people.
Right. So if you have homeless and unsheltered individuals, is that what you're referring to?
Yes, Miss Kathy.
Okay. Yeah, what's really nice about our senior centers, or if someone is 60 or older, these are cooling zones, warming spaces, and they can come in and get that meal at lunch. So if you have someone in that age category, make sure that they know about these centers because it is a warm place to go sit all day. Libraries work the same way, the county government centers, the Salt Lake City Library. There's a lot of places they could go to warm up, and we don't want them outside having more and more health conditions that then you are then trying to cover in ERs in different places. So yeah, these are really great buildings. If they're under 60, there are other various buildings in the county that they can go to, mostly their libraries and stuff, to at least, pop in and warm up, things like that. So thank you for bringing that up. That is a really important part about those buildings. And then we're also giant advocates. And if you don't know anything about Adult Protective Services or Ombudsman, it's really important that you study or look up both. Just put Long-Term Care Ombudsman Utah or Adult Protective Services Utah, and go out to the website and look at the three kinds of things that they deal with. Adult Protective Services is going to look into things like neglect, self-neglect, neglect of others, financial exploitation, things like that for vulnerable adults. And they have the definition for vulnerable adult on their website so that you can see what they look at. But it might be that, you know, the grandchildren talked grandma into selling her home, and they said they were going to put her in a nursing home and take care of her. Instead, they absconded with the money and paid her first 2 weeks at the nursing home and then basically wandered off and never returned. So, or there might be an ombudsman issue where someone is already in a facility that's a vulnerable older adult and they need their rights discussed with an ombudsman to help the nursing home or whoever treat them in the appropriate way. Maybe they are understaffed or their food is not as nutritious as it should be. Maybe they're not following guidelines. So those two right there, if you want to be an advocate for your office, because I can guarantee you during your career, you're going to see people who show up malnourished, not as clean as they would want to be, maybe even, you know, with bruises or other things. And you may have to call Adult Protective Services and say, you know, I want to put in this report. There's an online form you can fill out so that the people that you're reporting on will never know it was you that reported. They will never know. But you can put in a first-hand account saying, this is what I've seen. I'm really worried. Can you send an Adult Protective Service caseworker? They don't do wellness checks. That's not what we're talking about here. Like a police would make a wellness check or a fire official. But we're talking about actual suspicion of abuse, exploitation, all of those things. Or they may say just underhanded, well, I had money for healthcare, but my daughter made me buy her a new car. She refused to take me to get my groceries. So if you hear things like that, that's the kind of stuff that you would call Adult Protective Services and just turn in an anonymous, you know, referral so they can go out and investigate that. You're also going to want to know about 211, which we've talked about already, 988 for mental wellness. And it's just not a place to call. And this is what we've educated a lot of our caregivers on. It's not just a place to call if you're thinking about suicide and you already have a plan. It's a place to call because you're headed down that slope. You're exhausted. You're not sure who to talk to or where to get your support. And you may need to just talk to someone to start on a better, healthier path. That emotional distress is also part of that call. So also educating caregivers and your clients to do that. And then Seniors Blue Book, it's a really great book. It's only open in about 5 states, but luckily they have it here in Utah. You can get them free at pharmacies and stuff. They usually have little stands in different places. You can also get a hold of them and see if they'll drop off a little stand of them at your medical facilities if you want them. You just have to talk to them about how that works. But what it is it compares all the different facilities. They've got charts that says, if I had to choose a nursing home for my mom, does this one offer, you know, the various types of things that the doctor says I'm going to need? Because in all honesty, you hand us these big, long charts, right? It says there's 22 nursing homes on here. Which one do you want? We don't even know how to begin to make that choice if we're really tired and we're sitting in an ICU. So just knowing that you could make that a little easier in your offices by maybe having some other materials there that would help them make that choice would be really nice. So those are the kinds of resources that are out there, anything from transportation assistance to Meals on Wheels if they're homebound and really can't get out to go get a meal elsewhere. If they can get out and they can come down to the senior center, we also have buses that travel around within the zip code selection of each senior center that can pick people up and bring them over if they're not driving, but they want to come over and have a meal at the senior center, things like that. There's just a lot out there. I could talk for a week and I probably would still have the Rolodex going around in my brain, helping you find other resources. If you have a specific resource, we can talk about that in a few minutes when we're done with the slides, and we can just open it up for questions, let you ask me about specific ones that I can help you find. Now, this is a really important part that I have really gotten near and dear to my heart lately. I've been on a committee for this lately for the state of Utah, and the health literacy and access is really some of the greatest barriers that people will ever go through. A lot of offices don't have standardized resource letters or packet or resource shelves in them so that they can direct people out to further resources. Even if it was a standardized letter that says, thank you for being a new employee. I mean, not a new employee, sorry, a new client. In case you didn't know, Utah offers these really unique resources from 211 to whatever. Even if it was just a little standard letter, it would help people know where to call or know where to reach out as that new client from your office that might have some of the concerns that would fit under the resources you choose to put in your letter. Access considerations. A lot of times we say, well, here's your meds. Good luck going to find them. Not really that bad, but I have to joke about it because can clients pick up their meds? Can we do in-home appointments? Can they read the documents that you give them? Can they write? Do they know how to sign their name? Will you accept an X with another family member verifying that that's who they are? It's all of those kinds of concerns because we have people from a lot of different socioeconomic backgrounds, a lot of languages, a lot of education needs. Maybe they only, some of your elderly right now were raised by World War II grandparents or might even still be, Korean War vets or something. And some of them didn't get to finish school. They went off to war and they came back and it wasn't as important to finish school. You went right into a job. So there's just some of these complications that we don't even consider when there's someone sitting in front of us because we just assume that everyone can follow the processes that we give them. But in all honesty, they can't. They have some fears, can I come in? What's the charge going to be? Is there a cost for a translator? Can you find me one? There's just all of these barriers to care that you have to consider when you're setting up the procedures within an office space. How do they get appointments? So many things have gone electronic, and guess what? Our giant baby boomer population, most of them still have flip phones or one home phone. They don't have internet. They can't fill out your forms online. And we're always hoping they have a child or someone that can help us do that. But it's not always the case because we have older seniors that never had children that are relying on their neighbors. And they're borrowing the 15-year-old kid next door to help them fill out forms online on that kid's laptop because that's their only way to meet the needs that are currently all being pushed to electronics. So the forms, are they easy to fill out? Are they check boxes? Are they, can they be done that way? Do we penalize people and charge them extra if they mail a check versus paying online? Does that take even more away from their ability to pay? Do they have an understanding of the process? Is there discomfort in simply coming into a medical office? So as you're setting up your office, the more lovely you can give a little home environment right as they enter the door so they don't feel nervous about coming up to the, check in, that can be really important. Is there a plant? Is there a decent chair? I know you have to have good chairs that you can wipe down and wash for medical reasons in a lot of the offices, but still, is it a little bit wider chair because maybe I have just had a hip replacement? Being squished in smaller chairs is not optional. There's just so many weird things that come with setting up the perfect, to adding value to healthcare. There just really is. And then the Utah Health Literacy Coalition is working hard over these next year or so to build a website to support all the medical teams and everybody who doesn't know a lot about health literacy so that you can go there and figure out ideas on how to do stuff, all of that. But if you just look up any kind of health literacy right now across the nation, if you're out there doing a web search, you can find some really good ideas on the things you'll need to watch for. And then if you don't know about the library checkout systems, I love the Salt Lake County Library. I have the app on my phone. I know a lot of seniors can't do that, but they're getting really great at what they call their library of things. And I don't know if any of you know about this one, but the library of things has things like blood pressure cuffs, or different tools that they can check out. The doctor says you have to do this for the next 6 weeks, but what if they can't afford one and they don't own one? Where can they go check one out? Can they check out other tools that would be assistive? So if you haven't looked at the Salt Lake County library system and gone to their library of things selection, that has a lot of products and stuff on it that they can actually now check out of the library. So the libraries are really moving forward trying to support this whole caregiver and aging issue that we've come up with. They do have a lot of seniors that come in there to read and stay warm during the day or to cool down because they can't afford to run their electricity all the time. They can't turn up their air conditioning really high. So they'll come over during the day and read books and sit by the fireplace and check out the library of things. And so be aware that all of this stuff is starting new in the last few years. This stuff has really blossomed across our county. So I just want you to know it's there. And there's more support from you and for you than you can ever imagine. Okay, so this piece right here, and these are two of my caregivers, by the way, here on the left. This is two brothers, one caring for the other. And their story is so lovely, where the one is a construction worker. And so we always talked about how they were building and constructing a care environment. And their story was just lovely, but it's so cool to see what kind of caregivers are out across our valley. So I want you to think about what you can offer. We've talked about a lot of things today, but I want you to really physically walk around your workspace, visualize how you would want your workspace to look if you're going to offer the optimal visit. Do you have hand sanitizers by the door? Things like that. People are still spreading lots of stuff right now, so it's normal to healthcare. So, what is it that you can do to make things a little more, I don't know, not so unfriendly, but how will the room be set up? Are there different small seating areas, or is it just a giant open room with chairs around the outside wall that looks like they're all waiting in line to get flu shots? I don't know. What's your resource center look like? Even if it's a tiny one, even if you had 3 things in your resource center, if you specialize in seniors, do you have the local area agency on aging brochure? Do you have a 211 paper that you could print off from online? Do you offer donations of any kind? Do you work with vendors to, have a few things on hand in case someone needed something to go home with? Do you have advocacy posters and flyers put up on the walls so that they could see that phone number and call for help, especially when it's not something they're going to tell you about? But if you had some advocacy posters like Adult Protective Services, Ombudsman, advocacy for, or just family services or anything that they might, a 211 flyer or poster, anything where they could find stuff. You might have just this fun little unique row of posters that they could get the best jumping points to go find everything else. And then aging and caregiver friendly. Is it really friendly for your older couple that has to come in and sit down? Are there, a little bit longer seats the 2 people could sit on or whatever? Is there a place to get a drink? Is there a restroom close? Or do you have instructions up, say restrooms this way? Or are you understanding that the caregiver needs a little bit of extra support? I have to tell you, I have never been challenged as a caregiver like I have in the last month. And that has been very healthy for me in my field, because I was used to that 1 or 2 people needing help, but not 3, including ICUs and everything else. And there are some offices that have this aging caregiver friendly thing down perfect. They're like, why don't you sit down? How about if I help your mom walk down the hall and you just kind of wander down with us? Of course you can come in with your mom, those kinds of things. And if you ask for information releases, do they have them readily handy? Can they get them for you? Are you able to call in and get updates because your mom's hearing's bad? Things like that. All of this matters. Every single inch and ounce that you can offer matters. And I just like to share that with you because I can't tell you how many times someone has called us and said, can you come over and sit with me and help me figure out how this works because they don't have time to tell me at the office. You know, whether it's FMLA forms or anything like that. And yes, they have to work with their HR units on some of it, but some of it is things that we could be helping them with. It just takes us to breathe deep to offer a wellness package to people who step into our offices that is not quite so frightening and unfriendly. We know you're busy. I'm busy here at the county building. I can guarantee you we are short-staffed and running on all cylinders. But at the same time, we try to breathe deep when someone's standing in front of us and be present and say, what is it that you're asking me? If I could do anything for you right now, is there a resource you're looking for? And we just breathe for a minute with them and make sure we're present in their space. That's what you could do most to add value to healthcare. We are always going to be busy. We are always going to be understaffed. We're always going to have 50 phone calls we haven't gotten to. But the question is, are we present with those people that are standing in front of us when it's most needed? And I hope that we can be. That's the thing I like to advocate for the most. Okay, so I'm going to stop sharing and open this up for questions and other things that you might have. Does anybody have a question about an access point they have really wanted? It says, is there a one-pager similar with a flow chart or direct the patients to the right resources? Depending on what county you're in, most counties have a one-pager. On our website, we have the one-pager available on the Caregiver site, and I think we have it in like 7 different languages. So it tells you what Aging and Adult Services offers, but it has it in all those different languages, so that if at least they have an interpreter with them or something, it's easier for them to explain what's available. So we also have Joy Club booklets and other things that are all free online. They can, a family member or something, or can hopefully help them print it off. If not, we've got printed ones they can call and ask us for. We have a Joy booklet for them, especially if you have a family member with dementia or something and you need little activities in the house. We have that available in 4 languages. We have our Caregiver resource guide available in 7 languages with the major populations that we're working with here. So, you know, there's a lot of fun stuff out on our website. If you go to Caregiver, the Caregiver website, like we showed you, if you go to the education or the publications little buttons, they will have everything there in all the languages. It's all free. You can have whatever you need. Direct them to that. We've tried to get more health literacy friendly. Yeah. Thank you for the reminder to slow down off of real valuable help. What are your best resources for rural residents? Now, that's a fun part with Aging and Adult Services. We are all very aware of our actual clients, meaning we might have some checkout tablets if they have to do things from a rural environment. We may have a monthly food box delivery that rotates around because, you know, or be working with a church group that might be providing the Meals on Wheels for the small towns, but then figuring out other ways to get food out to the others. We're aware of those situations and we're working really hard to overcome some of those challenges. So if you get a hold of your local area agency on aging, whether that's 6 county, 5 county, Uinta Basin, whatever it is, they are good at working with those populations that they have the responsibility for. You're welcome. I'm really glad I could come today and help you with some of this. Any last resource questions? Did I miss somebody up here?
One of the questions is, what are the biggest challenges that you might face in providing the best care to patients? I mean, you mentioned a lot, but anything
Yeah,
else?
I mentioned a lot of them, but I would say the biggest challenge you're going to have is making sure they understand what you just said to them. That's the biggest challenge, because they're going to nod their head like, I think I understand that. I'm supposed to go home and fill out this paper. But then they get home and they stare at the paper and they're not even sure what to do with it anymore. So, you know, it might be taking that extra 2 minutes to help them understand the paperwork that they're going to walk home with, or maybe if someone at the front desk can help them with that, or whichever. So that's one of the biggest things. But we do have the one pagers. The other thing is making sure that they can access their meds. Now, a lot more places will deliver them pre-prepared in little packets, things like that, that you can get help with. You just have to check with the pharmacies in your area and what the options are, but let people know their meds can come in a variety of different ways. A lot of them don't even know that they can sort their meds in an electronic pill box and have a timer go off, and it just rings and rings until they dump the timer out. Yeah. So anyway, there's just a lot of stuff like that. So please note that this is a big industry. We're moving forward in a lot of unique and fun ways, but definitely look into your local library selections. Call your area agency on aging if you have a question. I had a doctor call me the other day and say, I found this old postcard in the back of my drawer. Are you still there? And I said, yes, sir, we are. So that was really fun to get him reconnected with what he had known once before. So, just don't hesitate to email, ask a question, call aging services. We have, our outreach workers are on the phone every day from 8 to 5. I know that's when you're busy too, but maybe you can have someone make a call. But yeah, and then if you need to ask a specific question, I know that this was a smaller group online, so that's perfect. Tatiana, feel free to give them my email address if they want to email me with a specific question, and then I can direct them out to whichever other locations they might need to go find. Because there is so much. Yeah, there's no way we could cover it in an hour today, but thanks.
You are such a wealth of information, Kathy, and we
Oh,
love
thank you.
your time with us today. You have given us a lot of things to consider and think that usually it might not be on our radar. For all the scholars and the attendees today, we will be posting this recording on our YouTube channel. I will be posting Miss Kathy's email as well for further questions. And I just posted the link for AHEC scholars to claim their attendance today as elective. And then we have a QR code for those that are not AHEC scholars too also. We would love to hear your feedback. Prithvi, do we know when our next Lunch and Learn will be?
So potentially in the third week of January 2025. And yeah, we'll share the details once we have them.
Very well.
I have a final question for Kathy. Thank you very much for this amazing presentation, Kathy, because most of us are literally not aware of most of these resources that you share. And we would like to be partners in helping, to make sure that all these resources reach most of the audience who would benefit from this. Do you mind sharing those one-pagers and any other resources that UTAHEC can help sharing?
Yeah, I can very easily send to you the links and also the PDF versions of a few of the most essential ones. If you want them in all the languages, you probably have to go out to that link, but I can very much share that with you so you can forward it on if you want.
Thank you so much.
You're very welcome.
I'm going to put on the chat Miss Kathy Nelson's email, ksnelson@slco.org.
Actually, that's changed. I'm so sorry. It's ksnelson@saltlakecounty.gov now. It's just in the last 2 weeks it's changed. The old one will probably come through, but ksnelson@saltlakecounty.gov. You have to spell out the whole word.
I think like this.
No, .gov.
Oh, oh my goodness.
Sorry. No, we're good. Do you want me to type it out there?
Go ahead.
Yeah, it's so complicated now.
Want to remind the scholars and the
Perfect. There you go.
Oh, thank you so much. Sorry about the confusion. That please encourage your peers, members of your other health classes to view this recording, as it has a wealth of information. And we wish you all a very happy rest of your day. And we will see you around. Don't forget to claim your attendance as scholars, and thank you for community partners and board members attending today.